we're going to introduce our first speaker. It's a great pleasure to introduce Dr. Ahmer Karimuddin, who is a clinical associate professor in the Division of General Surgery and General Surgery Residency Program Director at UBC. He works as a colorectal surgeon at Vancouver St. Paul's Hospital, and he's the president of Doctors of BC, representing 17,000 physicians. So he's here to give us some insights about what these Provincial Medical Association can do for us. So Dr. Karimuddin.
The story of healthcare in Canada, especially if you go back the last 40 to 50 years, has so many Pakistani stories embedded in it across from St. Anthony's, Newfoundland, all the way across to Tofino, that it's kind of hard to separate the two. And we're really privileged here to be surrounded by so many senior leaders in our community who've really shown us a route forward and figured out how it is that as Pakistani positions of Pakistani origin, we fit and work within our system here. Whether it's Dr. Shoaib with his, I checked yesterday, 687 publications, or Dr. Babur Rana, who's probably one of the most astute and dedicated community organizers that I know, or Dr. Omar Farouk, who was kind of my personal mentor without ever having actually met him from residency in Saskatchewan. One of the things that's important for us to keep in mind is that Canada continues to have the fewest medical spots of any OECD countries for Canadians to go to medical school. And so, historically, and I think for the near future, we'll continue to be dependent on IMGs. And so when we talk about Pakistanis coming here, that requirement for Pakistanis to help our international graduates helps the resource system isn't going anywhere. In 2024, no presentation around medical medicine or healthcare in Canada or really anywhere in the Western world should be done without talking about Indigenous peoples. 5% of the population in Canada is Indigenous or identifies as Indigenous, while really less than 1% of Canadian physicians do. There's more than ample evidence in both across North America that Indigenous and First Nations patients are less likely to receive evidence-based primary screening interventions, more likely to suffer mental health and addictions issues, and have worse outcomes after surgical care. And so next month is National Truth and Reconciliation Day in all across Canada, which is a holiday here in BC. But part and parcel of the work that we've done at Doctors of BC as a provincial organization is to work with our First Nations partners to figure out how is it that they're going to feel more secure and more looked after in our healthcare system. And that work led to this piece of art that you see in front of you. It was created by an Indigenous artist by the name of Rain Pierre, who, after consultation with the many First Nations groups across the province and Indigenous groups, developed this as a symbol of safety. So if you as a physician look after First Nations patients and want them to feel safe in your healthcare environment and know that you understand the burdens and the difficulties that they faced, and you spent some time looking at things like the In Plain Sight report, which in BC captures many of their experiences, and other literature that I'm more than happy to direct you to, please consider adding this to your in your office somewhere as a poster. This QR code that's up there is a direct link to order these posters to come to your office. It's free of charge, so you won't have to pay anything, but it's work that's being done through the Doctors of BC. So I'll talk a little bit about what is the Doctors of BC, and there in that stead you can hold all of your provincial territorial medical associations. So places like the Ontario Medical Association or the Alberta Medical Association. So we'll talk a little bit about that, about challenges and opportunities in the healthcare system and our work. What's really important though to remember is that the Doctors of BC has a long-term history of being around. These provincial territorial organizations in various forms have been around since the last century. The one in BC was established in 1900, many years before the first medical school even started, or even before the College of Physicians and Surgeons. And today, the Doctors of BC represents more than 16,000 physicians, residents, and medical students all across the province. They're governed by a board of directors, and there were 45 member-run committees. So if you're practicing in BC or anywhere across the country and you have a local provincial medical association, there's a chance to be very meaningfully involved with the advocacy work that's being done in your community by these member-run committees. Doctors of BC, representing 16,000 physicians, has about a staff of around 500 people, and that ratio holds true across the country. And one of the most important tasks that it does is that it negotiates the physician master agreement that governs all of your payments. So anything that puts money in your bank account tends to come through the Doctors of BC. Now, what we're not, and that's really important also to remember, is we're not the College of Physicians, and we aren't the Ministry of Health, and we aren't health authorities. So we don't control resource allocation in hospitals or credentialing with the college. We advocate for it. So when we talked about yesterday what Premier EB spoke about around CPS-BC taking too long for licensure, that's an area where the Doctors of BC advocates to reduce those burdens so people can move between provinces or move to BC in a much easier way. We collaborate with government and health authorities to support many of the issues that affect physicians so we can influence things. But we're not malpractice support. We don't provide audit support if, God forbid, you're ever audited by the CRA. But if it's a medical services plan that's giving you trouble, we can help you with that almost certainly. And we don't do active physician recruitment. So if your community is looking for new doctors, the Doctors of BC doesn't recruit. But what they do is help create things like incentive packages or an environment where recruitment becomes a little bit easier. So it really is your premier advocacy body for issues that affect physicians. What does healthcare in BC look like? Because this is where we are today and where we're hosting you, although it's raining a little bit. About 21 million visits to family doctors on an annual basis in BC last fiscal year. 1.77 million visits to the emergency rooms in the last year. We do more than 350,000 surgeries for a population of around 5 million. And that means that there's a significant demand for this work. And despite this many numbers, as all of you know, we're working in a system of lack where we just feel like there isn't enough of all of these things to get things done or looked after. In BC, about a year and a half ago, we developed a new longitudinal family practice payment model, which is probably the best in the country. And for those of you who are in family practice, please talk to your family practice colleagues here in BC and to figure out how this works. But that's really helped almost 250,000 British Columbians find family doctors who didn't have them before, and has recruited almost 900 new family doctors to BC. But still, there's about 800,000 plus family doctors, British Columbians who still don't have a family doctor, which is still important work that needs to be done. I'll spend a little bit of time talking about current challenges, which really exist across the country, and specifically more challenging in rural or suburban areas. And there really is no community that's not dealing with this, which is a shortage of physicians. Canada continues. It's funny, in the news you often read that Canada now has more doctors than it ever did in the past, which is not numerically true. But Canada continues to have the fewest number of doctors per capita of any OECD country. And British Columbia is at the lowest end within Canada as well. So it's an important thing to remember that while there might be many of us in this room, there's still more physicians needed to provide care across the province and across the country. Along with that, it's not just doctors. You tackle any job in healthcare, whether it's nursing, dietitians, pharmacists, physiotherapists, we are short. And we're short not just by multiples, not just by small percentage points, which creates its own challenge when you look at providing care across the province. And that means often doctors are doing things that are outside scope or which are more better done by the other people around them. This issue around lack then leads to issues around wait times and wait lists and access challenges, and even more concerningly, emergency department closures. Even this weekend, there's about 3 emergency rooms in the province, including one here in the Lower Mainland that's closed because of not enough physicians being available. And that's an ongoing challenge. Along with that, we talk to doctors, and this is important work that even Dr. Nadia Khan, who's in this room here today, has done a lot of work on around burnout. About 30% of your colleagues at any point report symptoms that are consistent with depression, not just burnout, and 48% report criteria consistent with burnout. So I'd like to think we as a community are a bit better, but I don't think so. I don't think we're probably representative of everyone else. And that means that half of the people in this room are in some way feeling the effects of being burnt out. And a lot of it comes with challenges around administration and paperwork and the extra things we're all asked to do because of the lack in the system. And it's those things that Doctors of BC tries to advocate for to try and improve. Along with that, no one is a stranger to this. Patient expectations are very different. I've been in practice for 17 years, and I think in those 17 years, I've seen patient expectations change even more so. And those of you in practice for longer will feel the same way. And that becomes a difficult burden for us to carry as doctors, especially those of us who are physicians of color or women physicians, because the expectations become even more different. Our standards sometimes feel a little bit different. So what does the Doctors of BC do to try and advocate for change in these spaces? Well, first of all, we are your direct contact with the Ministry of Health and your health authorities. So when there are challenges that many physicians face in their local healthcare space and they're feeling they've got nowhere to go, If you reach out to your regional advocates that exist across BC, they can probably with 1 or 2 degrees of separation get you in front of someone at the Ministry of Health or the health authority that can actually help you. Not just someone who can listen to you or say, there, go out and work harder, but someone to actually help you potentially find a solution to your problem. Or even tell you, which sometimes happens, that sorry, there is no solution for your problem. Because that's better than hearing pat, go away. The Doctors in BC has created these linkages with the Ministry of Health over many decades. And BC, for those of you who've been here longer, may remember that in the 90s, BC was one of the most toxic places to practice medicine. There was actually a physician strike, the only true blue physician strike since Medicare came in Canada, where physicians basically said they were shutting down their offices. And that went on for about a 2 or 3 month period. And that has then led to the fact, always after a divorce, a second marriage tends to be a little bit happier. So after the physicians in the Ministry of Health had a full-on divorce, the relationships are a little bit happier because they've learned what divorce looks like. And so that's given us many opportunities to advocate for you and physicians in a very meaningful way. And that's led to creation of these joint collaborative committees. So those of you who are in BC may have heard of an organization like the Family Practice Special Services Committee or the Special Services Committee or the Joint Standing Committee on Rural Issues. These are spaces where the Ministry of Health, the health authorities, and doctors literally sit down on the same table. So kind of like these round tables, and 8 or 10 people sit down, and they talk about thorny, difficult issues with a goal to find solutions. The idea being that, often when people think about collaborating, they talk about, talking to people who agree with you. This is collaborating with people who you're not going to agree with. You know you're never going to agree with them. But you need to have a goal in mind to just keep the healthcare system going. That's led to agreements to improve local engagement and collaboration for health authorities, for community and hospital-based physicians. So these are your facilities engagement organizations, your medical staff associations, your divisions of family practice. These are, again, tripartite groups that are there to help improve things. Sometimes they work, sometimes they don't, but the goal is try and work collaboratively together. Further, we were the first provincial jurisdiction in the country to actually have a formal agreement with the government that they will work with us to improve physical and psychological safety for physicians who are working in healthcare. Since COVID, the number of physicians who have reported feeling physically unsafe at their workplace, not talking about psychological safety, I'll get to that number in a minute, but feeling physically unsafe or have had an element of physical abuse, that number is around 40 to 45% across BC. The psychological safety number is around 65 to 70%. And this includes people who are in family practice, people working in emergency rooms, people working in addictions or mental health issues. Ask them about how they feel in the work that they do. One of my anesthesia colleagues here was wowed a little bit, but that's different, right? You have medications that take that patient aggression away. But we also have to remember this is occurring within a context where many patients, when they're coming in contact with you as a physician, have already been frustrated. Many of them already been let down. They waited months and months to see someone, and they're angry and they're upset and they feel like they're advocating for themselves through anger. But that leads to a very significant challenge for physicians, especially those of color and especially for women physicians. So we've got this working group in place that's working towards doing that. And then, of course, we have other contracts, initiatives, incentives to improving recruitment and retention, especially in rural settings that we work with. For the Doctors of BC governance, like any representative body, which is what we're talking about here for APPIC or for BC or BCAP, you have to have a board of directors and a structure that works. So for Doctors of BC, that looks like 9 board members, which includes with the president, which I am this year, along with a representative assembly of 108 members who help vote on policy things, which is from across the province. It usually comes from your sections or from your local divisions or your local medical staff associations. And many places there aren't a lot of people who put their hand up. So this is something that you're interested in. Think about, ask me how you can get involved, and I'd be happy to help. The board of directors helps to govern and oversee internal affairs and to help the strategic direction of the organization, while the representative assembly gives you an opportunity to come and talk about your issues and your challenges and offers guidance to the board. As I talked about earlier, one of the most important things Doctors of BC does is negotiate physician compensation, and that's about $7 billion annually. And what that means in BC, just to put it in context, that 1 out of every $10 the government spends is physician compensation. That includes things like, so that's more than what's spent on social housing, that's more than what gets spent on the education system. It's money that goes into physicians' pockets as compensation. Not saying it's not important, but just remember it's a very, very big ticket item. That includes things like compensation and benefits, targeted funding for physician priorities, or things like the business cost premiums that were negotiated last time, recruitment retention, or things like MOCAP that pays for after-hours availability. They provide funding for the medical staff associations and divisions of family practice to the joint collaborative committees. They support some of the group contracts that your groups have. So whether it's your local hospitalist contract or your local APP plan, those are supported, negotiated through the Doctors of BC, and any other agreement or contract, whether it's WorkSafe BC, ICBC, or any of those things. One of the most important pieces of advice that I think I've received and learned, and I share with everyone, is that if you're ever negotiating with your health authority or your hospital for a service-based contract with money attached, no matter how smart you think you are, and there's some very, very smart people in the room, you are not as smart as a negotiator sitting across from you. I promise you that. They are being paid to screw you over. They get promoted if they get a better deal for you. So, for example, if Dr. Nadia Khan is negotiating a contract at St. Paul's Hospital for internal medicine, and someone else is here is negotiating a contract in Surrey for internal medicine, if the guy in Surrey gets a better deal than Nadia Khan got, their negotiator gets promoted, and while their physicians don't know any different for 3 years. So please do not negotiate a contract on your own. Pick up the phone and call your provincial medical association to ask for help. I promise you're not as smart as them. So if you take nothing else from this, take this away, that if you ever negotiate a contract with any hospital or health authority, ask your provincial medical association for help. Another important role that the Doctors of BC does, which I'm to pivot here, is to focus on areas that relate to advocacy. Because we're your representative, we define our advocacy based on what we hear from you and from physicians. And we listen to our medical community through various touch points to figure it out. For example, every time you renew your membership for your provincial medical association, there's usually an 80-question survey or something of that sort, which no one likes to fill out. But that questionnaire actually drives the strategic direction and the tactical direction for that organization for the next year. So out of the 17,000 members in BC, probably like 200 fill out the form in detail. So think about if everyone in this room filled it out. The issues that are important to you and our community would probably be highlighted in a much more significant way for the upcoming year. When we communicate with media and other groups, again, which we can only do if we hear from you. And for us, our principles are simple. We look after physicians and we look after the patients of BC, and that's what drives our goals. So how do we advocate on topics, or what kind of topics do we advocate on? We do physician issues management. So if your local hospital, you're having difficulties, or your local community, we talk to your health authority about that. If you are we advocate for you if you're having long wait lists for your department. It might feel like nothing works, but there are places where we've been able to have significant shifts on wait lists because of things we've heard from our doctors about what works in those areas. The longitudinal family practice model, and I'm not a family doctor, but the longitudinal family practice model was one that was developed collaboratively from what we heard from BC family doctors and what we were told were things that were going to work really well from health authorities. So again, it's a collaborative process, so your input really matters. What I talked about as the agreement for physician health and safety, we negotiated last PMA in 2022, which was just after COVID. In 2021, that was not an issue. No one thought that physician safety was something that was of concern. It was only through hearing from doctors who were saying that this was a problem, or were highlighting this to their medical staff associations, that it bubbled to the top, and now is one of the most important things that we're working on from legislation perspectives. So please raise those things. Policy development, so what do doctors think about things like substance use care, scope of practice, digital health, all flows through this advocacy wing. And that's why there often are emails that go out, right, asking for your opinion or asking for surveys. Again, that's where that thing is coming from, so we can advocate for you. Along with that, we negotiate a number of benefits with the government of BC on your behalf. These include things like compensation, like I said earlier, but also includes things like insurance plans and pharmaceutical plans for you, retirement benefits, which is the CPRSP benefits that you get on an annual basis, or even some of the continuing medical education programs that come in. For the family doctors in this room, there's a very well-designed business pathways program that provides really good help in how to optimize your practice from a family practice perspective. It's free to you, so please consider reaching out. The average member sees about like a 5 to 7% increase in their take-home income if they engage with business pathways. So please think about doing that. We have got various other rural incentive programs, but more importantly, I think for the group here, we've got the physician health program. As I said earlier, I raised those concerns about burnout and depression as being a problem amongst physicians. Another number that will probably surprise you, wouldn't surprise you, but could, is that 1 out of every 6 doctors in BC has reached out to the Physician Health Program for help in the last year. Think about that. That's about 17 to 18%. That means that most tables have 6 people on their tables right now. At least one person at the table has reached out to the Physician Health Program asking for help. This is free to you. It does not cost you anything. It's negotiated through the agreement. It's completely confidential. They are not going to say anything to anyone. So please reach out to ask for help. Along with that, there's a Doctors of BC funded British Columbia Physician Integration Program that's directed primarily for IMGs. That's run through the Rural Coordinating Committee and its partnership with the UBC. But again, if many of you have gone through it and have been happy with it, let us know. And if you're not happy with it, please let us know, because again, it's for a service. It's done from a service perspective. So we need to improve it if there are challenges. I spoke already about these joint collaborative committees, tripartite funded spaces for doctors, health authorities, Ministry of Health, talking about Randy, and which have the 4 committees that work on them. And they're again funded through the PMA to focus on quality improvement, improve patient outcomes, and improve provider experiences. So it's really the triple value proposition that gets talked about, or triple aim. I'm going to wrap up soon because I wanted to leave a good amount of time for questions. But this was the Doctors of BC strategic plan. So when I was elected president-elect in 2023, the organization hadn't had a strategic plan for about 6 or 7 years. And that was something that I felt very strongly was important, was to listen to our members and develop a plan that would actually help us direct things in the future to see what doctors' perspectives were on the healthcare system. And there are a number of things that came out, especially from a vision perspective, which really, when we heard from our members, wanted to focus on doctors being seen as leaders in delivering and improving patient care, and for physicians to make the healthcare system better by providing patient-centered care and being trusted partners in innovation. And really, from a values perspective, it was really important for us to think about, okay, what do our doctors want to be seen as? And what we heard from our members through more than 7,000 touch points was they wanted to be seen by the public as someone who really cares for them and wants to look after patients, but do it in an excellent way by pursuing excellence, but also being courageous in the way they do that work, which sometimes means advocating and doing difficult things. And for the first time, and this was not tokenistic, I promise you, was the idea of inclusivity both in patient care and in the patient providers who were there. This was contentious, but it was an important one I felt from our perspective. I'm going to move through this for a second to go to the strategic directions and the priorities. This is what our members told us was important to them and why they wanted to see themselves being positioned. For them, it was extremely important that they felt that their voice was being heard and their influence of their voice was being helped to impact overall health of the population. As doctors, right, we get a real sense of our patients and their difficulties. We hear what their challenges are about navigating the healthcare system and what's keeping them from getting the best outcomes possible. So that lens can be used to advocate in the most meaningful ways for our patients. We heard directly from our members that what they wanted us to focus on was physician health, physician wellness, and physician safety in the workplace, given the number of doctors that feel threatened both from a physical and a psychological perspective in their workplaces. And then also around compensation and business supports. Healthcare is becoming more and more expensive. Overhead costs are increasing. And what are we going to do to create an equitable compensation package and enhance business supports? And then further, engaging with our members on what the future of the profession looks like and how we influence positively the culture of medicine in an increasingly diverse culture. So with that, I'll end. That still leaves us about 20 or 25 minutes for questions. Is that comfortable? So happy to help in any way, or we'll move along. Thank you.